Welcome to This Explainer. Today, we're diving into a profoundly important topic, understanding and healing trauma. We're going to build a bridge from the overwhelming reality of trauma straight to practical physiological relief, and finally, to long-term clinical healing. Let's get right into it. Here's our roadmap for today. We'll be hitting 5 key areas: the invisible wounds of trauma, the body's alarm system, an at-home vagal toolkit, the limits of self-care, and finally, clinical therapies that actually work. Section 1, the invisible wounds of trauma. Let's take a look at the debilitating and often delayed reality of PTSD. Trauma is often a completely hidden wound. Just take a look at this quote from a Vietnam veteran. "It didn't hit me until 9/11. My first reaction was, why now? Why so many years later?" It's wild, right? Trauma can just lay dormant and then resurface years down the line. Basically, when a threat is severe, our bodies have an acute reaction. And sometimes that intense startle response just absolutely refuses to turn off, even long after the actual threat is gone. And we're not talking about an isolated issue here. PTSD is way more common than you might think. It affects nearly 6% of all Americans at some point in their lifetime. I mean, just put that into perspective. That is a massive portion of the population walking around with their internal alarms practically stuck in the on position. Now, for our veterans, this risk shoots up significantly. We're talking up to 30% of Vietnam veterans and 29% of Iraq and Afghanistan war veterans facing a PTSD diagnosis. And of course, we absolutely have to acknowledge our female service members. They face not just the trauma of combat, but also disproportionately high rates of military sexual trauma, or MST, which seriously compounds the already huge challenges of readjustment. All right, moving on to Section 2, the body's alarm system. So if we want to figure out how to actually calm the body, we first have to understand exactly how trauma messes with our internal alarm system. Basically, trauma leaves you in one of 2 main extremes. You've got the activated state, where you're anxious, panicked, literally flooded with adrenaline. Or you've got the shutdown state, where you just feel completely numb, foggy, and disconnected. Identifying which state you're in is absolutely crucial because different states require entirely different exercises to get you out of them. This quote perfectly captures what happens when we get those exercises wrong. Consider the story of a woman named Michelle. She tried rapid deep breathing during a panic attack because, well, she read it online. The result? As she put it, it was like pouring gasoline on a fire. Why did that happen? Because she was already in an activated state. Rapid chest-based inhaling actually intensifies the sympathetic nervous system. She essentially used the absolute worst exercise for her specific state. And that brings us perfectly to Section 3, your at-home vagal toolkit. Here's where we start laying the very first planks of our bridge to recovery, using evidence-based vagus nerve exercises that you can literally do sitting in your living room. Take the concept of respiratory sinus arrhythmia. Now, that sounds incredibly complicated, right? But it's actually just the natural variation in your heart rate when you breathe. Basically, your heart speeds up slightly when you inhale, and it naturally slows down on the exhale, thanks to the vagus nerve. So when you deliberately extend your exhale, you are quite literally applying your body's built-in physiological brake. So how do we turn this into a daily practice? It's called the extended exhale technique. Here's how it works. Step 1, inhale through your nose for 4 counts. Step 2, exhale through your mouth for 6 to 8 counts. Step 3, just keep that up for 2 to 5 minutes. The absolutely crucial key here, and this is exactly what Michelle missed earlier, is that your exhale must always be longer than your inhale to properly signal safety to your body. Do this consistently, and you literally build vagal tone over time. But hey, what if you're highly activated, in a full-blown panic, and breathing exercises just aren't cutting it? That's when you tap into the mammalian dive reflex. By simply splashing freezing cold water on your cheeks and eyes, or slapping a cold pack on your face, you trigger this ancient reflex that rapidly drops your heart rate. It is honestly one of the fastest, most effective ways to force your heart rate down and slam on that vagal brake in an emergency. Now, what if you're in the exact opposite situation? What if you're in that numb, shutdown state we talked about? If you try a calming breathing technique then, it'll actually make you feel way worse and even more checked out. Instead, you need gentle activation. Believe it or not, humming or singing actually stimulates the vocal cords connected right to your vagus nerve. Splashing cold water on your wrists, or just doing some gentle rhythmic movements can help safely wake the body up and pull you out of shutdown. Okay, moving on to Section 4, the limits of self-care. Now, while these at-home tools are incredibly powerful for daily regulation, we got to be honest about their limits when dealing with deep trauma. Building up your baseline capacity simply isn't the same thing as healing the root trauma. Take Lisa, for example. She diligently practiced her vagal exercises every single day and successfully lowered her daily baseline anxiety. But she still completely froze up whenever someone just mentioned her ex-boyfriend. Solo work, no matter how disciplined you are, just cannot replace relational repair. So those wellness hacks you see, they're fantastic for building capacity, but they cannot replace a safe therapeutic relationship, especially when we're talking about deep relational or combat trauma. Vagus nerve exercises essentially build your nervous system's physical strength to handle stress. But to complete that bridge to recovery, you actually have to walk across it. And usually that means walking with a professional. Which brings us to our final stop, Section 5, Clinical Therapies That Work. Let's look at the final stage of our bridge. The clinical psychotherapy is actually proven to foster long-term recovery. The VA and the Department of Defense clinical guidelines strongly recommend these big 3 trauma-focused psychotherapies. We're talking about prolonged exposure, cognitive processing therapy, and EMDR. In fact, the research shows these psychological treatments are actually more effective for treating PTSD than medications, and the improvements last much longer. Let's quickly break them down. First up, prolonged exposure, or PE. This involves repeatedly thinking about or retelling the traumatic event in very safe situations. The whole goal here is to reduce avoidance. It helps patients safely face the exact situations, memories, and emotions they've been instinctively running away from. It essentially retrains the brain to finally realize that the memory is not a current active threat. Next up, we have cognitive processing therapy, or CPT. So unlike PE, which focuses on the memory itself, CPT focuses on challenging and modifying the specific negative beliefs and thoughts about the trauma that are keeping you stuck. It really helps untangle those heavy feelings of guilt, perceived danger, or broken trust that so often accompanies severe trauma. And finally, there's EMDR. This therapy is pretty unique. It pairs focusing on the distressing traumatic memory with simultaneous guided eye movements or other bilateral stimulation. The evidence shows that this process actively helps the brain reprocess the distressing information. It basically breaks the emotional charge of the memory so it can be filed away properly like a normal memory. Listen, if you take absolutely nothing else away from this explainer, let it be this: you are not broken. Experiencing PTSD or chronic trauma responses literally just means your body's alarm system got stuck in the on position. It is functioning exactly as it evolved to function during a threat. It just hasn't received the memo that you are safe now. But as we've explored today, there are totally scientifically proven paths to hit that reset button. So whether you start by simply practicing a 5-minute extended exhale tonight, or you make the super courageous decision to reach out for one of those clinical therapies tomorrow, you now have a roadmap. You have the actual tools to begin building your bridge to recovery. The only question left is, who will you share them with today?